Can we turn off the lights? Pwede i-off itong sa gilid.
Pipicturan na nasa laptop. Well, garage. Pipicturan. Ipakita ko na isa. Itong first bulong ba? Itong ipakita ka isa.
Pwede ba i-off niya ang lights
Itong
dire?
first bulong. Siyang cellphone. Itong pan, well, garage.
Sige lang, hindi mo
Pipicturan na sa
question.
screen.
Tanaw niyo yung question.
Pipicturan naman. Bantong mga
Di
tayo
maklaro?
mga question. Kaya di maklaro. Picturean man while the meeting ay garage mo.
Pa-off? Dili maklaro gyapon?
Good night.
Ikaw ba sa kahapon? Para sa ako
Parang ayaw mo kayo lang sa akin.
Dili daw mga lights.
Ano ko may kung si sir mo basa?
Ano sa mga ang Ruby?
Ha? Wala ko'y may.
Masigahon ninyong lights? Oh, ano yung nagtanak nimo? Ay, sino ko kawawa niya? Pag-as mo gihap nito sa in-charge. Hindi man mo kabalo, pag-as mo gihap sa in-charge. Once na nalang yumakot na mag-take down notes dira, stop na ko ha. Mag-record or what in form. Familiarize na ninyo. Okay, situation. Wala ko ba lang sa situation, but the situation, a competency that is expected from a BSN graduate is to develop a scientific mind through research. Okay? A research question states the effect of structured health instruction on the compliance of the medical regimen of patients with osteoarthritis. Participants in the study are all patients affected by osteoarthritis. Whole will be discharged after a whole week of confinement is an example of wala na makita ang other choices pero ang answer ana alpha. Mo na ang answer ana ang question. Arang-arang sa likod. Okay. So, the best answer there is alpha, pero kung abot sa board exam, more or less, di na siya mao ang answer. Di na siya mao ang letter. Nakuha? Other student, katong student leaders, pwede mo mag-stand up. Please check mo per table na ay magbantay per table. Disperse mo staff sa end to top. Disperse mo from corner to corner. Check lang yun. No recording, no writing, please. Maklaro? Saan sila? I-zoom?
Hindi ka makita ang kuwan.
Okay, a research question states that the effect of structured health instruction on the compliance to the medical regimen of patients with osteoarthritis. Participants in the study are all patients affected by osteoarthritis. who will be discharged after a whole week of confinement is an example of universal population. Yan yung sagot. Are we clear? Next situation. Stella, 26 years old, primigravida, 2 hours postpartum, arrived in the obstetric ward. Initial assessment of the nurse includes the following appearance: abnormally pale, pulse 90 beats per minute, blood pressure 90 over 50 millimeters of mercury, perennial pad, saturated capillary refill, postpartum hemorrhage. Muna ang situation kung anak ninyo kay dili na mo mabasa ang question. Nakuha? So, the topic siya, Stella, 0, primigravida, 2 hours postpartum, arrives in the obstetric ward. Initial assessment of the nurse includes the following appearance of abnormally pale, USPAD, pulse 90 beats per minute, both pasabot tachycardic ba niya or normal lang yung 2 hours postpartum, normal siguro. Blood pressure 90 over 50, that is hypotensive. Tama ba? Perennial pad, saturated, capillary field, postpartum hemorrhage. So, postpartum hemorrhage din siya ang topic. Okay? No situation, pero nabili na po question na po. Are we clear? So, muna yung question. Cancer, onco. Which of the following statement is not correct with reference to the term cancer? Which of the following statement is not correct with the reference to the term cancer? Palihog ko bantay sa door, wala kayo makasulod. Cancer and tumor mean the same and can be used interchangeably. Dili. Because there is a cancer that is malignant and a tumor is benign. Can you follow? Which of the following statement is not correct with reference to the term cancer? Cancer and tumor mean the same and can be used interchangeably. B. Cancer is invasive, spreading directly to surrounding tissues. C. A benign neoplasm is usually harmless growth that does not spread. D. A malignant neoplasm is harmful mass capable of metastasis. Okay? So the best answer here is alpha. Are we clear? Pero sa board exam, mas ibaylo-baylo nila ang letters. Nakuha? So ang first topic, but masabot oniko. Nakuha? Klaro? Okay. To practice nursing care safely in patient undergoing radiation, the following must be observed by the nurse except A. Limiting exposure time per shift to 1 hour. B. Planning the activities well ahead of time. C. Organizing supplies outside the patient room. D. Rotating the nurse taking care of the patient. Okay? To practice nursing care safely in a patient undergoing radiation, the following must be observed by the nurse except. Ibubot pa sa exception to the rule. Okay? A. Limiting exposure time per shift to 1 hour. Planning the activities well ahead of time. Organizing supplies outside the patient room. Rotating the nurse taking care of the patient, alpha. Because limiting exposure time, even though time na siya, pero balik-balik siya na-expose pa rin. Nakuha? So that is alpha. Are we clear? Next. Three. Take care of the patient with unsealed source of radiation implies to take care of patient with an unsealed source of radiation. Wala siya naka-seal, no? Implies, okay, wala naman nakita ang other choices, pero only siya ang answer. That bed linens are not changed unless grossly soiled. Nakuha? So, dili siya, the bed linens are not changed unless grossly soiled. Klaro? Move the time. The patient undergoing chemotherapy for breast cancer asks why she will have alopecia during the course of therapy. The nurse correct answer is the cell most actively affected are the fast dividing cells, like the hair cells. Nakuha? So, B, the chemotherapeutic drugs targets the bone marrow resulting to myelosuppression, irrelevant. This is a result of drug-drug interaction. This is a result of drug-food interaction. So, alopecia is related to the hair falls. Okay? So, what's the best answer there? That's alpha. Okay? Staff, atong Dorha, kung gusto niya magsulod og kalit. Okay. Breast cancer occurrence is increasing gradually over the years and women are becoming anxious about it. Which of the following risk factor is least associated with the incidence of breast cancer? Least associated. A. Diet or food. B. Increasing age. C. Family history. D. Therapeutic radiation. Ang sagot dito is diet or food. Okay? Na-process na ninyo? Number 2. The nurse knows that the diagnosis for heredity breast cancer is best established by testing for BRCA1, BRCA2, B. Breast ultrasound, Papa Nicolau smear, dili na mo makbasa ang delta. Are we clear? So answer ana is alpha. Nasabtan? Situation. External hemorrhage, Kokoy is driving his motorcycle under influence of alcohol when he had a head-on collision with another motorcycle, resulting to severe injuries to both lower legs and massive bleeding. He is attended by the ER nurse of the nearest hospital. Situation. The following are ways by which the ER nurse can render first aid in controlling external bleeding except, batayan ang mga except sa board exam ha? Next, A. Remove deeply embedded debris from the wound. So kung pagtamo na siya, bleeding na siya, di ba? Applying direct pressure on the wound, raising the injured limb above the level of the heart, binding the area of serial bandages. That's alpha. Are we clear? Okay, next. Mga kinaraan ang mga tambal. The nurse anticipates that the physician will order with parenteral drug to stop bleeding. Okay? Asa man mag-stop o bleeding, ana? Ibuprofen, tranexamic acid. That's alpha. Are we clear? Next. The nurse is aware that rapid blood loss starting over blank percent can cause hypotension and even death. Kana sila tanan na-cause siya og hypotension. Hypotension na sila. Pero asa na siya magsugod? When that is 40. Are we clear? Starting over 40. Sorry. The nurse is aware that rapid blood loss starting over blank percent. 40% can cause shock, hypotension, even death. Are we clear? A tourniquet, emergency nursing hand, a tourniquet is effective in controlling life-threatening bleeding. Recent research reveals that tourniquets applied in the limb may safely be released up to an average of black hours. 2 hours. Can you follow? Nakakasunod mo? Next, number 5. To prevent from getting infected when giving first aid to the bleeding patient, The nurse wears A. Gloves, B. Mask, C. Goggles, D. Gown. Gloves ang sagot.
Give it first.
Are we clear? Kana. Situation. Effective communication is essential in the delivery of sage and quality care to patient and must be practiced by everyone in the health institution. Communication. So, kani mga communication questions, inani ang attack per NP. Naku ha? So, naano may mga sample. Dili siya sample, dili siya sample. Pero, kana siya, inana ang presentation sa ibang NP. Balik-balik. Okay. The head nurse aura communicates to the newly hired nurse to use blood transfusion tubing to infuse which of the following? Cryoprecipitate. Are we clear? No situation. Putol. No question. Pero muna ang choices. Ang answer ani A. Using weight. So, itong duha na lang yung labanan kung sa yun ni. Di ba? Hindi na maganda mo makuha ang entire question. Hindi na makuha ang buong question. Hindi na ako explain tayo ng details. Are we clear?
Using o participating.
So, dili gid kung gawas ni si C o si D, dili gid na mo answer using weight bearing exercise, participating in aerobics, so dili gid na. Dili na mo ang answer. Naara gid na kang A o kang B o unsa to nga choice. Nakuha?
Times 120% per NP. So, kung piso ang kung piso
The nurse
ang
understands that in order for the patient to participate actively and efficiently in the exercise program, the patient is instructed to take her pain medication 30 minutes prior to the activity, have deep breathing exercise for at least 5 minutes, walk slowly around the room or house as preliminary, ask a relative to assist her exercise. So what's the answer? A. Nakuha? Nasabta na question? Nakalak na ang door? Nalagay ka, Rose Gawaso. Student na? Student na to? Kinsa man na? May pasulod sa kardiyata siya sa gawas. Hindi ka makasunta kong tapan. Ang mga babae din na pasunod na. Okay, klaro?
Very zoom out.
Ano man? Ano?
Zoom out.
Zoom in. Zoom out.
Yan, Ana?
Zoom out. Helicopter.
Kasi maayo ka mo diha mi.
Pwede, ako din.
Junay. Ikaw di ka na dili. Number 2, the nurse understands that in order for the patient to participate actively and efficiently in the exercise program, the patient is instructed to A. Take her pain medication 30 minutes prior to the activity. That's the right answer.
Ayaw na. Ayaw na. Dili na, dili na. Malangay.
Basahon na lang ang choices tanan. Ang answer na diretsyon.
Yes! Kalas kay Google.
Next. The nurse teaches the patient and family how to dress the post-mastectomy wound to avoid surgical site infection. The correct direction in dressing is from the wound going outside in a circular motion. From the wound going outside in a circular motion.
Makagaprat.
Pasahon na ito ni Haka, mas masipyat mo ani. From the wound going outside circular motion, from outside of the wound going toward the side, in a to and fro motion, basta.
Ayaw na nag-irasyo sila.
Sige mo na to.
Basta mauna na words.
The nurse informs the patient that to best manage post-op pain, the analgesic must be taken at the first onset of pain. The nurse informs the patient that to best manage post-operation pain, the analgesic must be taken at the first onset of pain. Next, wala siyang choices pero the nurse instructs the post-mastectomy patient to avoid which food? We will stop the rationalization because someone is recording. Ano dili magud ka sa Broadway?
Pagawas.
Ano nag-record ng bill mo nga? Ano sa yung purpose ng nag-record?
I-pop out.